Hello, everyone. I'm sending you beautiful afternoon greetings from Egypt. Welcome to our Global Young Academy Science Policy Advice panel. This is my Tolba. I'm the co-lead of the Global Young Academy Global Health Working Group. And it's my pleasure today to be moderating this panel in collaboration with my new colleague, Luciana Balboa from Argentina. This panel is a collaborative work between the Global Health Work Group and the Science Advice Work Group as well. And the session would be recorded. For your questions, you will have two options. You can add your questions to the shared Google document, and we will post the link for the Google document in the chat. So please feel free to add your questions. And we will hold a discussion session at the end of the panel. So you will have a chance to address your questions directly to our amazing speakers. And my colleague, Luciana Balboa, she will manage this discussion session at the end, but she would like to say hello to you before we start.
Yeah, for sure. Thanks, Mai. It is a pleasure for me joining Mai in moderating this international conference of young scientists, a conference which I think will be really wonderful since we will have incredible speakers and we will address timely and global issues on policy advice, on science policy advice. So just to get started with, I will invite Mai to present our first speaker for today.
Thank you, Luciana. So our panel today will focus mainly on lessons learned from the COVID-19 pandemic, and our respectful speakers will cover this theme from different aspects. We have a very distinguished panel from 4 different speakers from 4 different continents, and all our panel are amazing women in science. We have Professor Kang from India, and Ms. Emilie Karafillakis from UK, and Dr. Justine Germo from Cameroon, and finally, Dr. Alma Hernández from Mexico. So I will start with introducing our first speaker, Dr. Emilie from the UK. She's the European research lead of the Vaccine Confidence Project, and her talk is entitled Building Trust, Managing Risk, Vaccine Confidence and the COVID-19 Pandemic. Welcome, Emilie.
Thank you so much, May. Thank you for the introduction, and I'm really pleased to be here with you today. Let me see, I hope all the technical issues, I'm the first one to go, so I hope this works, and I hope you can see my screen. Yes. But really, thank you. Really a pleasure to be here and to talk to you about the work that we do at the Vaccine Confidence Project. And we've been, as a lot of you have, really busy in the past year and a half now, working on trying to understand how people's perceptions about vaccination have evolved, changed, increased or decreased in relation to vaccination since the pandemic, and I hope I'll give you a bit of an overview of what we've found. And perhaps before I start, I think it's nice just to ask as well. There's such a diverse group I can see already in the participants. So if you can take a couple of minutes just to think about what do you think are the biggest challenges of maintaining or improving confidence in vaccination, whether that is a COVID vaccine or vaccines in general, during times of uncertainty like a pandemic. So in your own country, what would you say is really the biggest challenge, if you can identify one? And I don't know what's the biggest way, if some of you can, pop in an answer. If I can take like 30 seconds just to hear a few answers, that would be great, if that's possible.
I just enabled the chat so everyone can write your answers in the chat.
Thank you. Well, that goes ahead. Let me get started, and we can always come back to that in the discussion as well. So I know this session is about the lessons learned from COVID, but I think there's lessons to be learned from much earlier than that, and lessons that we haven't learned, because vaccine confidence is not a new issue. It's not, it's been talked a lot in the past few years, especially since the WHO listed it as one of the top 10 threats to global health. That was in 2019. So it's definitely risen on the political agenda, but it's been there ever since the first vaccine against smallpox was created. And this is a cartoon that you can see from one of the very first anti-vaccination group, if you want to call them that way. So already at that time, there were issues with the vaccines being produced, and issues that we haven't necessarily learned lessons from. And if you look at the key issues that people had at the time, so back in the 19th century, you'll find that they're quite similar to the type of discussions that we've been seeing on vaccines in general, but also with COVID-19 vaccination. So for example, one of the big issues at the time was making vaccines compulsory, and they were afraid that smallpox, which was a new innovation, was going to be made mandatory. What have we seen with COVID-19? So many discussions, so many talks about your individual freedoms to choose whether or not to get vaccinated, whether that's as members of the public or even as healthcare professionals. Where is the line that dictates how much of an authority the state has over your own health and your own decisions over your own health? These were questions that were already quite prominent at a long time ago. And I'm sorry, I know there's some background noise. I really hope that that's not heard too much. A second point was about the principles of, sorry, excuse me, close the window. The principles of vaccination that were quite new and not well understood. So it was a new innovation in the 19th century. People didn't really know how does it work? How can you inject something and then all of a sudden you're not going to be sick anymore? We've seen that with COVID as well. We've seen that concerns about new technologies, new methods of developing vaccines, talking about that was back at the beginning of the vaccine development, talking about the DNA, RNA vaccines and what are the potential risks of those. So again, the issue of novelty, the uncertainty surrounding things that we don't really understand. Religious and philosophical concerns have also been quite prominent from the very beginning, and it's been the case with smallpox, and it's been the case with any vaccine that's been introduced in a range of countries. And again, we've seen this with COVID as well. We've seen, for example, when we talk about religion and ideology, it's not only religion, and the word ideology here is important as well, because we're talking about the groups of beliefs that we belong to. So what do we believe? And how, if we believe in health, for example, in natural treatments, then some people might be against vaccines because they don't think that fits in their use of natural medicine. And then, of course, the beliefs that vaccines are unsafe or ineffective, which is what we're seeing the most. And it's really been one of the key concerns that people have had around COVID. So things haven't really changed. And there's this plenty of studies that have been published since the beginning of the pandemic showing how people feel and their intentions to receive a vaccine or not. And you've seen what's interesting. This is a study from 2020, and the situation has changed a little bit. But what it shows, and this is showing Europe, what it shows is that countries that already had concerns about vaccines in general are countries where you're having issues with COVID-19 vaccines. So in a sense, if you have low trust in vaccines in general, or in science, or in governments, that means that in the country, you can expect some issues with acceptance of the vaccine as well for COVID. And the key issues, again, that we've been seeing, and that's true, I think, around the world, have been about the safety of a potentially new technology. How do we know that this vaccine that was developed so quickly is really safe for us to take? How do we know it will really work? What about in 3 months' time, in 6 months' time, in a year? Like, what will happen in that time? We don't know yet. So these are the type of concerns we've been seeing. And something else that's interesting is how it's changed as well over time. Because confidence, if you look at trends over time, you've really seen how it's increased and decreased. And in many countries, what's happened is with time, when the vaccine was actually introduced and started being used, confidence dropped. So people when it was actually available, they're like, oh God, it's really happening. Am I really ready to take it? But then it slowly started increasing. And that's the case, for example, in France, which is one country with the lowest confidence in vaccination in general, but also for COVID. And it slowly started to increase. So it's really varying depending on the information that is present at the time when you're doing the actual survey. Something to mention is that, especially in times of uncertainty, it's very often all about risk and risk perception, and not only risk of vaccines, but also risk of diseases is how we make decisions, is how do we think, something that we'll do will be influenced by the potential risks of vaccinating versus the risk of not vaccinating. What's interesting is that in times of uncertainty, this is very much linked to emotions. And as I mentioned, individual and rights and freedoms, that's also another topic. But the emotions around our perceptions of vaccination are still there's still such a gap in understanding how that dictates how we accept certain interventions. Hope is a key one in so many places and can really drive vaccination. Fear is obviously another one, but we need to understand these type of reactions to be able to address them better. And trust is another key issue that we really need to understand, because our perceptions of risk would also depend on how we put trust in the people that tell us whether something is risky or not. And we live now in a world where technologies, where I was mentioning this, are evolving all the time. So technologies are, you have more and more technologies, you had new risks that are coming up that are becoming more difficult to measure, to understand as well. So we need that trust to really place in people that can tell us and assess the risks for us. And we've seen that vaccine confidence is really much linked to trust in science, trust in governments, and of course, the most crucial one, trust in healthcare professionals. So we've seen in studies that healthcare professionals are the most trusted sources of information when it comes to vaccination. And they're a key player in responding and trying to improve trust in COVID vaccine as well. They're the ones who are having these face-to-face conversations with people to try to rebuild the trust that might have been lost. I want to make a small point about the internet as well, because we often see in surveys that people don't trust the internet, and we shouldn't be worried about that. But then we've seen, and that has been the case with COVID more than ever, that trust in the internet is not all that matters. It's not that if you say that you don't trust the internet, that you're not going to use it or going to be influenced by it, because the more you're exposed to information, the more it sort of influences the perceptions that you might have, even sometimes subconsciously. And more importantly as well, trusting in the internet doesn't mean anything, because the internet is not one entity that you trust or don't trust. You trust the sources that post information on the internet. So if someone claims to be an expert and posts information, why would you not trust them? And so that's how we've seen the spread of misinformation with COVID and rumors with COVID circulating in groups from healthcare professionals and experts as well. I just want to say as well that it's not all negative, and what we've learned as well from COVID is that there are also possibilities for opportunities for improving the situation. And we've seen that a good example is with influenza vaccination. And we've seen that during the winter season, at least in Europe, there was a drive and a really strong demand for influenza vaccination. So there are opportunities, while people have never heard as much talk about science as they have today, terms that they wouldn't have heard 2 years ago about the RNOL and all these things. So there are opportunities as well in these uncertain times to work on that. So in terms of what we can do about it and what we can how we can improve this trust, I think we need to move, that's really one of the key messages, that we need to move beyond the state of it's all about knowledge. If people knew about how, they knew the risk, if they knew this how safe the vaccine are, they would get vaccinated. No, it's not. It's really not about the information. It is important to have it, obviously, but if you don't address the trust, the emotions, the group identity that you might belong to, the ideology, the context, if you don't address all these issues, then you can provide the information, but it will come into one ear and go by it through the next, and people will not necessarily respond to these. So we need to think about how we can work in better ways. And that goes mostly through better targeted communication that really uses the medium that people also use. But first and foremost, it starts with listening, and it starts with engagement. So we need to start making not only communication decisions, but making actual decisions about science and healthcare with patients, understanding that, you know, we are in a world now where people are more empowered, they're more engaged in their own healthcare, they are going to look for information online, and we've seen that with COVID. So we have to stop fighting that and instead engage patients ourselves in the processes of making decisions. And I think I'll stop there because I might be running out of time. Thank you.
Well, wonderful. Thank you. Thank you very much, Dr. Emilie Karafillakis. Sorry. For your presentation, which really offer us so many insights on how to build trust on a priority global goal, which is the acceptance of COVID-19 vaccination. So, well, I'm sure we will get the best of your talk during the questions and answers session later on. But for now, we will move to our second presentation for today, which will be held by Professor Gagandeep Kang. Dr. Kang is a professor at the Department of the Gastrointestinal Science at the Christian Medical College, Vellore, India. She's a physician scientist working on vaccines and public health, particularly focused on children and enteric infectious diseases in India. She's a fellow of the Royal Society. So welcome, Professor Kang, to this session. We are very happy to have you here today. The title of her presentation is Problem to Public Health, Using Data to Inform Policy. Well, a very promising title, so we really can't wait to hear you.
So thank you very much for having me here, Mai and Luciana, and thanks for the introduction. So I'm from a small town in southern India, but it's in India, everything is relative. So my small town has 1 million people, and the hospital that I work in is 2,700 beds. Currently, we are dealing with SARS-CoV-2, and we have 1,200 beds that are filled with patients. So we've really got a long way to go. It's been an interesting experience for us, as it has been for everybody else, to live through the last year and a bit, and we've learned a lot. One of the things that we've learned is just how much data matters, how much honesty matters, how much transparency matters, and how little of it we sometimes have, particularly in low and middle income countries. So if we think about what you need for policy, when you think about policy processes, you have to identify what the issue is that you're looking to solve. You figure out, you know, what are the ways to identify how big the problem is. Look at the results, look at the alternatives, choose what you think is the best option, establish policy, implement it, and then seek to evaluate it. As you can see here, all of this requires quantitation, and without quantitation, without accurate measurement, we don't have a sense of the size of the problem, or if we are to implement solutions, how well those solutions are working. So policy processes need to start and end with data, with really understanding what the data are that matter. But there are lots of stakeholders for whom all of these are important. And the more you look at policy, the number of stakeholders and the interactions between them becomes more and more complicated. So if it's that complicated, how do we find our way through this maze, particularly as groups of scientists that work in multiple different areas? Now, if you look at the factors that influence policy making, evidence is one part of it, but there's also experience, and in some parts of our world, eminence. And in many places, eminence actually trumps expertise. So if you sit on committees, you look at policymakers, a lot of the people who have the most influence are not necessarily the ones that are most expert or most informed. Cultural issues also play a huge role. To a panel full of women, I think I'm not telling you anything new when you think about being on a panel or in a discussion and being completely ignored just because of your gender. It's happened pretty much to all of us in all parts of the world. So making yourself heard and making sure that you are contributing can sometimes lead to you being labeled difficult in many settings. But these are things that we know, we live with, and recognize that we must persist. So many factors influence policy. And if we look at low and middle income countries, one of the things that I always look to as an example in healthcare is what Thailand has done with very limited resources. Thailand is a country that is ranked 6th best in the world for healthcare. They started 40 years ago to make evidence-based decisions for any investments that they would make in technology or in the delivery of healthcare. They set up a structure where they actually gathered data, looked at what the globe was doing, and then did technology assessment before making decisions, comparing choices that they had for interventions that they could apply, what would work for them in their setting. And that investment has really paid off, because of which Thailand is where it is. Even if we look at SARS-CoV-2 and what has happened, cases are increasing in Thailand right now, but they have had a pretty good history of control over the last year or so. And even now, with cases increasing, based on their population, they are nowhere nearly as badly off as other parts of the world. So it is possible for us to do things if we make sure that we use data, use thoughtful processes to inform policy. So what is it that you need to know? You need to know about the external environment, the political context for policy, as well as the evidence. As researchers, as scientists, we focus on the evidence, but really to get to policy, evidence is insufficient. You need an awareness of what else is required. So what do you need to do if you want to look at policy making? What you need to know, I've already pointed out to you. What you need to do is you need to understand process. You need to recognize opportunities. For the evidence itself, you need to make sure that sources are credible, that the solutions are practical for the setting that you're talking about. Present very clear options and communicate them using familiar narratives. Without that, it's not going to be something that policymakers will be willing to look at. And then making sure that networks and the right kinds of stakeholders being involved in policy are available to you and you know how to interact with them. How to do it? Again, credibility comes with people recognizing you for the quality of the work that you do. And that needs to be communicated appropriately. So when we think about data to inform policy, what we need to understand is that data is only one part of getting us to policy. And that's never been more true than in the past year. So I'm going to use for you the example of deaths in India. Everybody's been very aware of what has been happening with us in the last 6 weeks. The images have been pretty graphic. But let me just walk you through a couple of these graphs that look at what are the cumulative COVID-19 cases in India. You can see that India is now second in the world in terms of the cumulative number of cases. The United States with over 30 million, India now beginning to approach 30 million, and Brazil at over 15 million cases. However, if we look at deaths, even though India outstrips Brazil in numbers of cases by over 10 million, when it comes to deaths, the rank order is different, with the United States, Brazil, and then India, though the numbers in India, the numbers we admit to in India, continuing to climb. Now, a lot of people have asked, how did we wind up in a situation like this? How did we wind up in a situation where the dominant narrative about India has been about funeral pyres and what's happening with people being unable to mourn their dead? Well, the causes of error are many. There is lack of reporting, and we know this very clearly, that many places have been told not to report deaths. Many places have been told to attribute deaths to comorbidities rather than to SARS-CoV-2. There has been deliberate undercounting in the sense that if somebody has not tested SARS-CoV-2 positive or has died at home, then you're going to ignore those deaths. But it's very important to remember that even within countries, within regions, the scale of error can be quite variable. So in a state that is reporting a high number of cases and a reasonable number of deaths, that state's figures might actually be more accurate than a state that reports hardly any cases and hardly any deaths, because the infrastructure is too poor to be reporting. So here I'm showing you a figure of the city that is closest to us. This is the city of Chennai, and in blue you see the 2015 to 2019 average deaths being reported. And you see the figures for 2020 and for 2021. This is registered deaths, just looking at excess deaths. And the estimates that are made is that we've already, in this small period, you can see the case count of deaths on a daily basis. It's estimated that this year already we have undercounted 12,000 deaths. So the scale at which we are undercounting is huge. When you don't have a measure of deaths, you don't have an understanding of the size of the problem that you're dealing with. You have hospitalizations and deaths. If the hospitals are full and people can't get into hospitals, then your hospitalizations are an undercount. If people die outside of hospitals and deaths are deliberately undercounted or misattributed, you have no size of the scale of how badly you are affected by SARS-CoV-2. And without data, making policy becomes difficult. And when you introduce interventions, then when you measure the impact of those interventions, you're not going to have a sense of whether you've got the correct estimate of whether your interventions are working or not. So I think for all of us, it's very important to understand that life, health, and disease are being investigated in an increasingly quantitative way. We now are in a situation where medicine and public health are producing huge quantities of data. And that can be something like Google mobility, the amount of information that we can get on how well lockdowns are working. Whoever thought of looking at mobile phones moving around as a way of gathering data that would inform health? So we've learned of many new data sources. We need to think about integrating all of them. And we need to make sure that we are not wasting time collecting data that is not going to give us insights that are not actionable. So there is a lot for all of us to do. And I hope that in a new world, we learn how to do it quickly. From data, we need knowledge and understanding, and hopefully for the next pandemic, we will have the wisdom that will allow us to have a clear path to making sure that we are doing the right things with data as early in the pandemic as possible, if not before the pandemic. So research, innovation in medicine and in public health is going to require a lot of stakeholders to come together. We will have to pair methodologies and skills with problems. In LMICs in particular, doing studies in humans in health and disease are not simple. It's hugely complicated. But it is a moral imperative to use all of the data that we generate for new insights and for new scientists. We need for young people to grow, and we need the platforms from which young people can move towards opportunities or challenges. So just to end, I think investing in young people is critical. This is the best way to harness collective knowledge and energy. For me personally, I'm more towards the end of my career, but I find that if I listen to young people in a kind of reverse mentoring approach, it opens up insights that I couldn't believe I could have. So investing in building up and building out and dispensing with hierarchy is the only way to go in a data-rich world if we are to think about the future of public health. Thank you very much.
Thank you very much, Professor Kang, for your enlightening talk. And I'm sure you will have a lot of discussions at the end. I'm seeing a lot of questions already were added to the document. So now I will welcome our third speaker, Dr. Justine Germo from Camaroon. She's a member of the GYA, and she's a plant biotechnologist and a researcher in the Institute of Medical Research and Medicinal Plant Studies, Ministry of Scientific Research and Innovation. Her talk will be about science advice mechanisms and the challenges in Africa during COVID-19. Welcome, Justine.
Justine, your microphone seems to be still off.
Oh, okay. Can you hear me?
Yeah.
Okay. Thank you so much, Mai, for introducing me. I'm really happy to be part of this panel, and thanks to the co-leads, Felix and Benyam, and all the members of Science Advice Working Group for giving me this opportunity. So it's a great honor for me too to share with my co-panelists on this topic and all those who are present actually in this conference. So my part will be to bring maybe a better understanding or to this platform, decision-making, science and public during this COVID time. So I will talk about science advice mechanism and challenges. I'm trying to, okay. In Africa during COVID, during COVID-19. So I will present it according to this plan. I will do an introduction. I will talk about the role and responsibility of science advice actor. I'll talk about trust in science policy platform and challenges, the way forward lesson for science policy and society, and then I will conclude. I will start by saying that I have experienced science advice workshop to the government with INGSA, International Network for Government Science Advice, first as panelist and then as member of the African Chapter Steering Committee. So this platform has taught me and I've learned a lot on science advice in general, and also how it's important, the interface between science and public policy. Science advice, what is science advice? Science advice then is also called science for policy. It's a consultative organ or process to direct the bunch of information, scientific information, in order to help orientate, evaluate, or inform policy and decision-making at all levels. So this can be through sharing experiences, capacity building, scientific opinion, explanatory notes, statement, report, and development of theoretical and practical approaches. So science advice or science for policy is different from policy for science, meaning the policy that influence the conduct of scientific research for a better impact. It could be to increase funding or give more opportunities. Science advice has then the potential of helping policymakers in clarifying what can be possible to be done and understanding their impact and evaluate policy already carried out. In fact, generally, when there is emergency, whether it is natural disaster or man-made disaster, each part has an aspect related to science or to technology. With COVID-19 pandemic, then science advice has never been in greater demand. Policymakers, media, wider public were looking and still looking after scientists, engineers, or other experts for a better understanding and better solution. Some experts call science advice an art. Why? According to Glazier, he said that it's an art because of three main points that I had in his document. He says science advice affects area beyond science. It can affect value and judgment and need to be given in a responsible way. That's why he said it's also an art. He said that the management of all the complexity of information, coming from different disciplines, different judgment, different approach, and be able to give a credible advice is more than a science, is also an art. And when it comes to give recommendation to policymakers, instead of giving a report with full data or evidence-based information, when we tell like a story with anecdotes, policymakers can better understand and it could have better impact. So who are the different actors of science advice? In INGSA website, Professor Madiane Diallo published a document entitled Contributing to a Better Understanding of Science Advice in Africa. There he presented Africa with several structures or organizations which play the role as advisory body at national, regional, and international level. We can see the Academy of Sciences with the role of assist and give advice to the government for the better implementation of the National Strategic Plan. We can see the Economic and Social Council who help the government to define national economic and social policy. We can also have at the regional or sub-regional level, network for example, for academia, we can have African Union too, with the different member states who has many advisory boards. We can also have the United Nations in general, with his United Nations Economic and Social to assist and provide technical and scientific preparation to the strategic decision making. So there are therefore some principles that sustain science advice. According to the Organization of Economic Cooperation and Development, this principle allows the public, the politician, to better receive and understand the scientific information and facilitate setting of advisory committee. So we can have well-defined, they will have well-defined mission, role, and responsibility of stakeholder, means that each stakeholders in the advisory board need to know the limits, what he can do, what he cannot do. It need to have a legal framing of individual and all the institutions involved in the advisory board. The other aspect is inclusiveness, meaning involve relevant actors, including all the experts in science related to the topic, even non-scientific experts, civil society, all the range of skills related to the topic. Another point is to produce strong advice, non-partisan and legitimate. Here we can find strong scientific evidence, transparency, communication in complex manner, or scientific uncertainty or area of contention. It needs to be neutral, apolitical, not focused on religion or other consideration that could influence the decision. The truth is that in Africa, policy and decision-making process receive external influence because of the convention or agreement they sign at the regional and international level with organizations and funders. We can also note that there is still a dialogue of the depth between the scientific knowledge available and its use in the decision-making process. However, with the pandemic of COVID-19, there has been and still be a renewed interest on science advice. There has been the creation of scientific ad hoc committee in many countries, relying on the result of scientists to find the solution. This has been seen in even the choice or the use of treatment protocols and vaccine. In many African countries, for example, the government has set up strategies to encourage in endogenous solution, hence the valorization of biodiversity in the fight. Indeed, many researchers or actors of traditional medicine have produced improved traditional drugs such as COVID organic, which by time was promoted by the highest authority in Madagascar, Gulbetara from Camaroon, which has been successfully administered to thousands of patients. A group of pharmacies in Mali put in place Balembo and Apivirine from Benin. So now let's talk about trust in science or in policy. This figure represents the percentage of people with different level of trust in the government and science. It had been shown that the vast majority of people who have high trust in the government have trust in science, and the majority who do not trust science has little trust in the government. Trust in politics match together with trust in science, but there are some cases where people may trust more scientists than politicians. Trust in case of COVID-19 rely to the capacity of the government or scientists to be reliable, impassioned, efficient, but in this case of COVID-19, the trust has been very weak. Why? Because the race toward the finding of solution face many challenges. First of all, COVID-19 is a new virus. This implies changes, scientific evidence not yet complete, leading to uncertainty that need to be well addressed to policymakers, media, and wide public. There is disinformation also and misinformation, which alter trust to science and scientists. Let's just remember that the manipulation of facts or evidence is not new. It has been amplified by the power of digitalization. This allows people to deny sometimes the gravity of the pandemic. We can note the dissemination and communication strategy of scientists to policymakers not well appropriate, and because there is no formal structure to facilitate that. The dissemination of communication strategy of scientists or government to the wider public were in official language in Africa, which is not the language used by the many local population. In Cameroon, for example, there are more than 280 local language, and most of them, most of the strategy to fight against COVID-19 were using French and English, constituting a barrier to the rural population to receive the good information. We also listed the challenge of transdisciplinary few collaboration between different aspect domain of science, like natural science, social science, human science. We can't forget also the lack of solidarity between scientists who criticize themselves openly, alter then the trust of the public and the media to science and scientists. Concerning the way forward, even with an uncertainty, science advice process respecting the principle we have listed before, such as inclusiveness, neutrality, is necessary for good policy. Establish or improve mechanism for dialogue between policymakers, scientists, media, public to fight against COVID-19. African also countries should be rethinking of their priority, in particular, increasing the investment in science, technology, and innovation to reach at least 1% of their gross domestic product as required by the African Union. As mentioned by an expert, with the challenge facing Africa government, it requires effective coordination at the national, regional, and sub-regional level to develop internal mechanisms to support and inform decision-making. I will conclude by saying that scientists should be honest brokers, according to Roger Pickler Jr., meaning that they need to be able to help decision makers to choose wisely between the available options of a given topic. Also, science, technology, innovation, and a strengthened science policy interface is required to face the COVID-19 pandemic and other coming disasters. Younger scientists also need opportunity and career incentive to engage the public debate. So thank you so much for your kind attention.
Okay, thank you very much, Dr. Justine Nzweundji, for your presentation about science policy strategies adopted in Africa, and for bringing up practical examples of science policy links. So now we will move to our last presentation for today, which will be held by Dr. Alma Hernández-Mondragón. Dr. Hernández-Mondragón is the author of research articles published in international indexed journals, has taken and later given courses on scientific diplomacy, scientific advice to government, evidence-based decision-making, and is an enthusiast in communication and dissemination of science. She is a member of the steering committee in the Latin American chapter of the International Network of Government Scientific Advice, and coordinator of Advisors in Science and Technology Commission of the 63 legislature of the Chamber of Deputies in Mexico. Also, she was a visiting professor in INGSA, and she is a GYM member. So welcome, Alma, to this panel. We are really very excited about hearing to your presentation, which will be about training programs on science policy at interface, challenges, and opportunities. So Alma,
okay.
The floor is yours.
Thank you, Luciana, and thank you for all of you. Thank you, May, for the invitation to share this virtual table with all of you. This is a great honor for me. Thanks. As you mentioned, my name is Alma. I'm from Mexico. And in this talk, I want to share with you some of the findings that in the 10 years, in the last 10 years, I was working. Well, I want to share with you why I think that these training programs that are important for us, for scientists. And let me start with a little act. Here, this is a a discussion, a general discussion, and there are a lot of complaints in all the world about that the policymakers don't know nothing about science. So in Oliver Millman some years ago wrote the top 20 things that politicians need to know about science, right? Because they don't know, so they doesn't know. So, but this is real that we need to learn a lot about policy. So Chris Tyler wrote the 20 things that scientists need to know about policy making, right? So at the end, Roland Jackson wrote a piece about the 12 things that both policymakers and scientists should know about the public, because there is very common that the public lost, that the public feel lost in this discussion between policy workers and scientists, right? But in order to make a good contribution for this, and we can see that there are a lot of relations imply, we can find these fields named science policy interface that has been defined as the processes which encompass relation between scientists, policymakers and other actors, and that follow then allow co-evolution, joint venture, making a best, enriching the decision making, right? This includes other significant actors, such as the researcher, the policymakers, other organizations, but this is real that we need to train in this field in order to connect and mediate between science and policy. Why this is important? Well, I think that this COVID-19 pandemic shows how essential is the scientific evidence, right? And how important is the role of scientists for this process, and that it can be a determinant factor for the society. So that this is a real also that simple providing information is not the same that give evidence, or that it doesn't translate like a good policy, right? And several big challenges in all the human history have been through relationship with science and policy. We can discuss the reasons, we can discuss the goals, we can discuss all of that, but this is a real thing, right? Well, in this slide, I want to I show you the results for an American survey made to American citizens in order to ask about their support for an active role for the scientists in the public life. And I think that it's very clear that they think that scientists should engage with elected officials and with the public, in different topics, maybe more or less, but I think that this is clear, that public policies should be based on science. Most of people mostly say yes, I strongly agree, or I agree. But the question is now, are we as scientists ready? Because as you see, what is a public policy? Well, we can use a very simple definition, that is a course of action, create or enact, typically by a government in response to a real world problems, right? And this public policy, has mentioned Dr. Capper before, is they are staged that looks so simple. There is a problem definition, you need to do the agenda settings, the policy development, the implementation, the policy evaluation, and once again. And it seems so typically like another thing that we know a lot, the scientific method, you have the observation, right. And at the end, you need to say, Eureka, this works. And well, all of, I think that all of the people here know about the difference between the theory and the practical side. So as explained before, there are a lot of actors communicate at the same time, at the same in the same level, in different parts of the process. And and I asked you where science is, and well, in countries like mine, like Mexico, there is in nowhere. The scientists and the scientific the science is not present in anywhere. So obviously, has mentioned before, there are a lot of challenges, starting with this, no? Be timely and helpful, be clear and concise, be neutral and impartial, and this is I think that is one of the most important. Science is not everything. Science is only one thing in the table for a decision maker. Well, I think that for do a best job, to do a good role in this, we need to learn how to deal with the fact that being right is not enough, that you don't underestimate your counterparts, that is different advice and advocate, the difference between the executive, the legislative power, and even the judiciary, that you need to be accurate, but at the same time avoid technicism, that the science in the policy making and policy evaluation, where the place is, you need to know how to connect internationally, the difference between academia and policy arena, and most important, I think, how to deal with frustration. in this, this is a big, sorry, this is a big, but this is the kind of work that you only learn by doing. So I think that that is the reason, because training programs are so important on this. And the science, technology, and science and technology policy fellowships in United States, they start almost 50 years ago. Israel, Asian region, Canada, India, Mexico City in 2 years ago, we were able to launch a program, the very first program for this science policy interface fellowships. And then I work with the Argentina and the International Center for Research for Global Change, and they launched a science a STEP program, the Science, Technology, and Policy STEP fellowship program. And well, I think that this is the only 2 programs in Latin America. And I think, well, I want to introduce with you, this is the first cohort of this science policy interface program in Mexico City. Adriana, Beatriz, Daniel, Vicente, Aline, and Monica, they are amazing people, and they are doing a terrific job. They are working, 4 of them are working now in formally in science policy interface related issues, one more than other, but this they are a little seeds in this crop. Well, an example for their work, for example, they propose that the Federal Congress, the Parliament in Mexico, has an internal capacity for science advice. And well, we are working now with that. But I think that this is the kind of work that science needs in countries like Mexico. And I want to share with you also that this you might think that a scientist is a person, well, not you, but so many people, in a white lab coat who spends their life peering down on a microscope or a telescope, or I don't know. But there are different sorts of career in science, and you can make a big impact, maybe greater than if you write only papers, but you need to encourage people to do that. Obviously, there are some key elements. This kind of building trust is the most important, I think. And you need to know also that you have a seat in the table, but you don't have a vote. You only, you are an advisor, not a decision maker. That you can, you should understand the decision-making processes. This kind, you need to develop these communication skills, for example, the elevator speech, right? I think that persist, insist, and resist, and mostly be resilient is so important. In Mexico, there is the only way to do something. Obviously the temporality. And here are some remarks about this. I think that policy, we can agree that policy requires scientific analysis, values derived from policy, that this science policy interface help to close this gap between science interest and policy priorities. That scientists will learn about policymakers' requirements, and policymakers will build understanding of scientific capacity. I want to ask you, please encourage to your college students, friends, or anything to become a science policy interface practitioner. We need more of us working together in this in this world. Well, and I think that that's we don't not only can work on science for policy. I think that we also work within policy for science, but that's other topic. And thank you so much. That's all for me. Thank you.
Well, thank you very much, Alma, for this nice overview. That really, I think it makes us actively research careers feel that being involved in science policy interface is feasible and, most importantly, valuable. So thank you. So we will now jump into the questions and answers session. Before that, I would like to remind all participants that you can make questions by posting them in the share Google Drive file, which is copied in the Zoom chat box. And also you can raise your hand and make the questions aloud if you wish. Okay, so let me start with the reflective questions for the panelists. So in the meanwhile, we wait for more questions to be posted in the file. About what I think is the key factor, which at least to me plays an important role in hurting public trust on scientific evidence, which is the fact that, or which is associated to the fact that knowledge is dynamic in nature. So I have the impression that people lose confidence when when scientific knowledge is updated. So because they perceive a sort of contradiction with previous recommendation, and it happens a lot during this pandemic. So should we wear masks or not? Can asymptomatic people transmit the virus or not? And so on. So my question is, how should we address this intrinsic uncertainty, which is associated to scientific results, and present it to the public as an strength instead of the weaknesses of the scientific method? So I don't know who would like to start by answering this opening question.
I'm happy to start because we are dealing with that a lot in India at the moment, especially with regard to changing recommendations for intervals for vaccination. And I think the difference in the ability to communicate is really a baseline difference in trust. So if you trust your government, you tend to trust scientists. I think Justine had pointed that out, that when you have that trust, then if you are told this is a learning process, as we learn more, we will and should expect to change, you will accept that. Whereas if you have a government that is not trusted and is not transparent, and the recommendations chop and change all the time, then you're going to have a population that says, oh, nobody knows what's going on. How do we trust anybody else? It's a waste of energy. It's a waste of resource because it just makes people anxious. And you can see how frantic people are getting because the message is changing and they don't have a clear explanation of why that is happening. There are so many dissonant points of view that are being put across. How do you expect the public to know what is a credible voice and what is not?
Thank you. Thank you very much. Does anybody else would like to add something else related to that question?
Well, if I can add a few words, perhaps,
sure.
from our experience in vaccines, and I completely agree that trust is the key element here on this sort of people accepting the changes in information. But I think on top of that, what is key is also sort of how you build that trust. And what we've seen is that countries that have very transparent information, and not only in terms of what we know and we don't know. So if we don't know something, it's really key to explain that we do not have that information yet. But similarly, it's also important to say when things go wrong and when decisions have been made that shouldn't have been made. So when mistakes have been made, acknowledging these mistakes is really key in safeguarding that public trust. And we've seen that countless of times in countries where it hasn't been the case, and that has just further eroded public trust in official sources. So transparency is really key here.
Perfect. Thank you, Emilie, for your input. So I think we can maybe go on. I can see that Anindita, she has her hand raised. You can go on and ask if you wish now.
Can I ask a question?
Yeah, sure.
Yeah, thanks. So this is primarily for Professor Kang, but anyone else can answer if you like. Professor Kang, you mentioned, and even we saw in the presentation that if people trust the government, they trust science. But then across the world, we have a lot of examples, including ours, where the government is propagating misinformation, pseudoscience, and a lot of people trust the government because they have elected this government and they think that the government is right. In such a situation, what do scientists do, and how do we ensure that trust in science exists and it's trust in science and not pseudoscience that gets percolated?
Anindita, I think you've highlighted something that is a particular problem when the elected government chooses to ignore science, and that is not new. Many countries have had situations like this to deal with, and scientists have found it very difficult to be able to stay true to what they know they should be doing and not be swayed by what the government is expecting them to comply with. It is hard, but one thing that really helps, and this is an age where it is more true than 20 or 30 years ago, is to bring in points of view that are external to your country, to make the argument based on information that is coming from multiple parts of the world, and argue for the fact that science is now a global enterprise, and not every government and not every nation is thinking in exactly the same way as your government is expecting you to. But it's a challenge.
Thank you.
Thank you. Okay, so now we will go to the share file. We have, first of all, a general question by Filina from Sri Lanka. She wants to know, how does science diplomacy and science policy interface overlap, and with respect to evidence to policy pathways to control COVID-19 pandemic? So the question is concerning the overlap between science diplomacy and science policy interface.
Well, if I might.
Yeah, sure.
Yeah, thanks. Well, I think that there are a problem, an additional problem, because in many countries, there are, for example, in Mexico, we have no one known department for science policy, for example. And I think that in all of yours maybe could be, and there are a lot, but there is always a problem with the definitions. You know, or the people thinks when they hear science diplomacy, things in one thing, maybe in scientific relations, in international collaboration, or when they hear science advice, they think that is almost the same, but at the national level, or maybe, I don't know, there are a lot of confusion about that, but it seems clear that the interface between diplomacy and advice, I think that it's my personal view. I think that all these kind of skills are needed in both in science diplomacy and in science advice in science policy interface, and that they share a lot of common interest, and that we need to learn a lot about different tools in order to participate and to, I think that has mentioned before, the first objective, the target in this is to build trust in with the policymakers, but also with the public, with the society. And I think that I don't have the simple answer, but well, thanks.
Thank you, Alma. So we will now go for a question for Emilie. The first is from Philippines, from Lawrence. How do you stop misinformation? This may increase the fear of the vaccine.
Right. That's interesting one. So I don't think you can stop misinformation. I think you know, misinformation has been circulated even before social media, so it's not something new, and it's not something that you will ever be able to stop. I think there are a few things that we can do to try to limit it, and most importantly, to try to provide more positive information and make sure that people go for that positive information instead of the misinformation. I think there are probably 4 key points. I think we need to, in terms of limiting it, you know, there have been things with working, for example, with social media platforms that try to moderate the information that is posted on the platforms, but that actually has a lot of issues in itself as well and raises a lot of questions. But most importantly, instead of doing that, we need to make sure that the people that communicate positive information, so that we have a bigger presence on social media of public health communication, public health agencies, governments that at the moment are not sufficiently on the platforms. And at least even if they are, they're not even reaching those who actually have concerns about vaccines. The third is we have to know how to respond and when to respond. So sometimes you will see posts, misinformation that circulate but won't attract any attention. And sometimes by responding to it, you're actually drawing more attention to it than it originally had. So you need to learn sort of when to when to respond and how. But I think that the really key point that I want to emphasize is the importance of training and education. And it's on one hand on how to use social media to communicate better, and that's through healthcare professionals, for example, that have to have a stronger presence online, but also training the public and starting in schools on training children how to understand science, how to look for information online for science and health issues, so that they know how to identify misinformation and what is correct information and differentiate between the two.
Thank you, Emilie. So now we will move to a question for Justine. It says, looking at the local approach used by many African countries to manage COVID-19 using medical elements, is there any effort by the EU, ECOWAS, or any international body for that matter to test the potency and potentials of these approaches by refining them using global standards?
Okay, thank you. What I can say is that traditional medicine is recognized even by the WHO, because they say that in Africa and in many countries, 80% of the population rely on the traditional medicine for their healthcare. So with African Union, there's some strategy who encourage the member state to valorize the traditional medicine. We have, for example, the 31st of May, which is the date of celebration of Africa traditional medicine. Now, each country has the choice to make it legal, because actually there are many projects of the law, for example, in Cameroon, to make it formal so that we can practice, as in some country in Asia, traditional medicine at the hospital, so that someone will have the choice between traditional medicine and modern medicine. So now, what I can say, so in spite, what the problem with traditional medicine is that there is a lot of controversy about how the way they put the product in place, how they develop them, how is it efficacy of that product, because it didn't follow the conventional method of production of drugs. So with traditional improved drug, they don't need a several type of tests. And actually in Cameroon, what the Ministry of Health is doing is to allow researchers or establish lab to accompany those traditional healers to test the efficacy of their product and also their toxicity. So in Africa level, in African Union, there are some framework concerning traditional medicine who are trying to make country valorize the medicinal, the traditional medicine. That's what I can say.
Okay, thank you very much, Justine. So we have a question for Professor Gagandeep. The question is, how can we better learn from other countries' experiences? In many European countries, we don't look at Asian experiences with COVID response, despite them being quite successful. How to tackle isolationism and nationalism in policy debate?
I think there are two things here. One is that countries in Southeast Asia and East Asia have had experience of outbreaks before with H1N1, with SARS-CoV. They learned a lot of things during those outbreaks. They learned about the importance of surveillance, the importance of identifying infected people, the importance of isolation to limit spread. They also began wearing masks much earlier and being more rigorous about them. These are countries that by and large either trust their governments or have learned to follow the directives of their governments. So given that the governments and the people have experience of outbreaks before, in general, they did quite well, particularly in the first wave. and were able to limit cases and mortality as well. Now they are dealing with a more infectious virus, but even there, they're not as badly off as yet as other countries have been. So this experience is one that the rest of the world should have recognized and followed early on, but didn't, because quite frankly, the Western world is very averse to learning from the East. And that has been a feature of practically everything to do with public health and with medicine. Even for, speaking to what we were discussing earlier, traditional medicine, standardization, artemisinin was not something that was accepted for a very long time, even though it was known in the eastern part of the world. So how do we deal with isolationism? That's a different question from learning from the East. Isolationism and nationalism, to cut yourself off from the world to protect yourself, and then to make sure that your own population is protected before you think about anyone else, comes actually from history. We've done this before for infectious disease outbreaks, down to towns walling themselves off during the plague and Black Death, right? So this is not new. The thing is, we are a much more interconnected world now than we were in the 14th century. So if we think about what's become the words that everybody uses, we all have to be safe if we want to protect the world. So isolationism, nationalism are short-term solutions. They are not long-term solutions for a pandemic. So we will have to, Australia and New Zealand, done well so far, but they need to open up at some point in time, not going to stay walled off forever. So a lot for us to do, but most important, recognize that we are a connected world.
Okay, well, super clear. Thank you very much. So we will go to a question for Alma. So it's from Elisa from Mexico and Netherlands. Well, first, she congratulates you for the presentation, and she said that she was wondering how transferable of country-specific are training for science advisory, like science policy interface fellowship in CDMX in Mexico, I guess.
Okay, thanks. Well, totally. This kind of training, it are very similar. For example, for the fellows in Mexico City, I had the help of great friends from and college from the International Network of Governmental Science Advice, and for ex-deputy fellows for this program in United States. And most of the things are shared, but it doesn't matter if there is a country like America, like United States, or a country like Mexico. You only need to take a base that tells them what can they expect, and the rest it's arises on its own. And I think that even we can make a common platform for this training. And thanks.
Thank you, Alma, for the answer. We will move to a question for Emilie. It's from Robert. He from GYA. He says, how do we, public health professionals or science communicators, balance evidence communication and persuasion? When is persuasion unethical?
I don't think it's been established. I think it's still ongoing debate of how far can we go and how we present information, especially because that question is not only about persuasion, but even mandatory. And even today we have debates about whether or not it is ethical to make vaccines mandatory, especially new vaccines. But that comes back to the problem as well of what I was saying of social media platforms that have to, at the moment, limit misinformation online. How can we ensure that, how do they know what constitutes misinformation? It's these type of questions that are still very difficult to answer, and they will also change from one country to another. What might be acceptable in one country might not be in another country with a different culture and a different communication mechanism. So it's quite a difficult one to answer. But I think overall, the key point is we need to make sure that we communicate what people want to know rather than what we want to say. And that's really something that we haven't done enough, and we've been focusing too much on putting out the information we want to spread without actually focusing on what the people really want to hear.
Thank you, Emilie. So another question for Gagandeep is from Abhijit from India. Do you think that the lack of clean data from the first wave made managing the second wave even more difficult? Would people and policymakers have acted differently if we had better data from the first wave? So what's your opinion?
I think if we had built better data systems the first time around, had clearer data the first time around, we would have been better positioned. And because we didn't do that, because we didn't establish the systems or the standards, we are now in a situation where we have multiple parallel databases that don't talk to each other. And that makes interpretation very difficult. You can get absolute cumulative numbers, but you can't interpret anything because you can't link, let's say, cases with vaccination, except by maybe geography, and that's pretty much it.
Okay, well, we are about the time, so I think we will have to leave the further questions for the next session, which will be open for everybody, so we can still discuss about all this on the Wonder Space, which you can join us. And well, just to close, I want to really thank you very much, the speakers, for the very inspiring talks, and to the audience for the comments and questions. I would like to thank to the Chihuahua office for assisting us and making this event possible in a so efficient way. We really hope this conference has contributed to raise awareness on this timely and global issue, and to encourage us to get engaged in specific actions aimed to maintain a trusted scientific to public relationship for advising on public policy. So, well, before saying goodbye, I just would like to repeat that you can join us into the following networking session on the Wonder Space. So, well, for those who cannot join, I wish you all have a good day and stay healthy and safe. Thank you very much.